it's a beginning to end, I suppose, with looking at it from a systems perspective. So it starts very early on with an introduction of what we mean by human factors and what that looks like, but all the way through there's a thread that is constantly giving different types of examples, and we've tried to draw from different areas of healthcare.
The book is structured around a systems framework, the so-called SEEPS framework. It's the Systems Engineering Initiative for Patient Safety. The book looks at all of the elements of the work system, so the people, the tasks they need to fulfill, the tools and technology they might be using, the physical spaces where work happens, the organizational environment, and then also the wider external environments.
There's also some bonus material, and a couple of those bits of bonus material include things like looking at organisational change. In healthcare, we often talk about responding to patient safety incidents by learning. And the reality is, if you don't see organisational change, then you can't really say that you've learned. So we have a chapter that looks at organisational change in some detail. Another chapter that we have looks at equality, diversity and inclusion. And those things are really important, both in terms of patient safety, but also in terms of workforce satisfaction, etc. But also many organisations will, of course, at the moment be needing to respond to those EDI issues, and that chapter will be very helpful in that.
It's a way of taking a lot of the themes that any human factors practitioner might be familiar with, including things like task analysis and interface design and measurement and outcomes and teamwork and non-technical skills, all of those different things. And really making it easy to understand and digest and apply within health and social care.